paracetamol, zinc, vitamin D kasana.
The Ministry of Health has trained over 60 village health teams, VHTs, on the surveillance and taking care of COVID-19 patients in their localities under the home-based care management. The Ministry officials, in conjunction with Nama Wellness Community Center, NAWEC, have conducted the 3-day training of the VHTs from Nama sub-county in Mukono district.
Their role is actually to support the COVID response at village level.
Pauline Picho, the executive director, NAWEC, says the VHTs have been sensitized together with some of the local leaders and the health personnel from all the health units in Nama sub-county.
We are currently offering training for our village health teams and also the clinical team to respond effectively to COVID-19. This is because we realized that actually we didn't have the capacity to handle the cases that we were encountering as the clients come to visit the clinic for healthcare services. Our community health workers, like the president directed, that are supposed to be reporting cases from their communities and making surveillance, and they lacked that skill to do that. They didn't have the knowledge on how to participate in the village COVID task forces.
Brenda Nakanwagi, the Ministry of Health Community Engagement and Social Protection Officer, says the VHTs are so useful at this moment when there are severe COVID-19 community infections which can no longer be traced.
We all know that the patients are in the villages, the leaders are in the villages, and so even the response should start from the village. And so we are here to actually train the village COVID task forces and the VHTs in that package and how best can they support COVID patients.
We hope after this training, they'll be able to effectively engage with the community, give educational information, and also create awareness and sensitize the community about COVID-19, how it can be prevented, and how they can interact with the formal health systems in regard to access to healthcare services, as well as participating in home-based care for those who are tested positive for COVID-19 that are supposed to be isolated at home.
Nakanwagi adds that through the VHT's routine sensitization in communities, the ministry believes people will now acknowledge that COVID-19 is real and start embracing the standard operating procedures.
As we all know that the country, of course, entered phase 4. And phase 4 is the phase where we actually don't know where the COVID cases are. But the cases and COVID is in the population. We cannot trace who has it unless if someone comes out and tests. So because COVID is in the community, so we had to stretch further as a Ministry of Health to make sure that we plan and also we extend services closer to the people.
She, however, warns the patients to avoid carrying out self-medication before seeking the attention of the qualified medical officers.
With this, I still question the population that please, however much you think you've read enough, you've researched enough about COVID, please don't think that probably I have symptoms of COVID and let me just start myself on medication. We would advise that as the VHT comes to your home and advises you, or as you have the contacts to the VHT, call your VHT, go to the nearest health facility, now up to the lowest health facility in government. They can now test for COVID, okay? Then once you've been assessed, the health worker will advise you based on your symptoms, based on your health history, whether you'll be sent home or you'll be actually sent to a treatment center where you can be monitored.
She adds that they have also equipped the VHTs with gadgets which are to help them execute their duties.
And the VHT will support in monitoring you on a weekly basis or on a daily basis based on the number of patients they have. The VHT will be visits this person to check on you. The VHT has, now the Ministry of Health is working towards giving each VHT, at least each village, a VHT toolkit. And within this toolkit, it has items that are very key in monitoring a patient and supporting a patient. And these include the thermometer to make sure that they monitor your temperature, And of course, they know the guidance that when someone has temperature for some days, then that person is probably a high-risk person. It will have a pulse oximeter that they will use to measure your pulse, and then they will also use to measure your oxygen levels, okay? And then it will have a meter that they use to measure someone's breath rate. And so, and then within the package, of course, there will be medication. Though now we are not putting medication because we intentionally want every patient to go to the facility and let the facility be the one to evaluate you and tell you which medication you need based on the evaluation.
The VHTs have, however, expressed fear about the only protective gear they have, including the face masks and sanitizers, saying they may expose them to the deadly virus.
Nze kyagwanye Edward nga nze VHT w'omu kyalo kino eky'Ennama watudde olukuŋŋaana luno. Okusomesa kwaffe ku COVID-19 batugambye tugenda kubeera na mask, sanitizer, gloves. Kyokka oluvannyuma ne bagamba nti bajja tuwaayo akaveera ke tubeera nako. Kyokka era omusomesa amugambye nti ku TV ndaba nga bo abakola mu COVID-19 balwali babeera beesabise bonna. Ne ntyamu nti bo batusindise mu ddwaniro ffe kufiirayo.
Amanya nze Kyambadde Julian, di VHT okuva Empoma, mu NCHAP program. Ekigenda okuteeka mu katyabaga engeri gye tuli ba frontliners. Ebikozesebwa bino birabika ng'ebyobulamu. Okugeza tutidde nnyo tulaba bannaffe ababeera ku TV baba mbadde nga basobola okuhandolinga biki ebigenda mu maaso. Naye ffe tugenze okwesanga ng'ebintu ebyo bikyabulamu.
Of course, number one reason is the type of patients each cadre manages. The patients that are managed in the community are usually COVID patients that have tested positive. Some of them test positive, but they don't have any symptoms. Okay? And then others are those that have tested positive, but have very, very mild symptoms of COVID, and they can actually manage at home. But usually patients that are referred from home to facility are patients that are high-risk patients. These are patients who are struggling for oxygen. These are patients who are really at risk that any time, because of their struggle, because of their condition, they can put the health worker at risk. And that's why health workers dress up differently. And so for our VHTs, we advise them that based on the type of patients, category of patients that you're managing, the basic toolkit or the basic PPE protection wares that you need is a very good mask. Put on your mask and make sure it's well placed, okay? And then the other thing is make sure you do hand hygiene and social distance.
Dr. Edward Basenga, who has been one of the facilitators, stresses to the VHTs to ensure self-isolation to all the COVID-19 suspected and confirmed cases.
So I told you in a separate room.
Andrew Bangis, also from the Ministry of Health, says the VHTs are going to save the community because currently the treatment centers are overloaded by COVID-19 patients, yet even the private hospitals are so expensive.
First of all, I would say it's unfortunate that the private health units or facilities have hiked the costs of managing corona patients. But in this way, we believe that as it is actually researched and evidenced that not all people who get corona disease or COVID-19 disease end up in hospitals. It's that the majority, 80–90%, do not need to be in hospitals. They actually need they not need the admission. So in this case, these who don't need admission, those with a mild disease, mild symptoms, who actually look normal but they actually have the virus in them and they can transmit it, those need to be cared at home.
Because in the supermarkets, all these bottles have, we prove that they have COVID. n'aleka akawuka ku supermarket n'agenda n'akwata ekikere ky'amata n'akikebera galanga basigamanyi n'agaza shefu n'alekako akawuka. So supermarkets ezisinga ebintu ebyo byonna bye mulaba biriko COVID